Our healthcare system is broken. So let's do something about it. We've launched the Real Value Exchange, a podcast to share the stories of providers, entrepreneurs, and the change agents pushing healthcare forward.
What's up, everyone? I'm Joe Lemon, and thank you so much for listening to the Real Value Exchange. And I gotta get this off my chest. It's late. It's almost 1 o'clock, and but it's like 10 o'clock back on the West Coast, and I just got back into Atlanta. I had a great couple meetings in Denver, but I read this article in the medical economics on the flight over, and it's kind of brought me back to all my conversations and the meetings that I had in Denver. And you know, one of the big questions that they threw out there was, what would it look like, or what would happen if the insurance company didn't exist? It was just totally wiped out. Another way to think about it is, what if the insurance company put the patients first? Like, there's a lot of garbage and BS that we do, especially in healthcare. I think that, I'm making this a theme of the Real Value Exchange, is that, I didn't realize that the whole value-based care conversation has been going on since the early 90s. But I mean, there's so much a minutia that's baked into trying to take care of people, right? And there's so many extra steps that we are making this already complex idea of understanding the body and just trying to keep it at its peak performance and trying to help people get the most out of their lives. We're making it even more complicated with simple things like ERP systems and these garbage billing codes. So one thing that has been a common thread of all my conversations, or common theme in my conversations while I was in Denver, was, we were just talking about, this direct primary care setup. And I'm not sure if you guys are kind of familiar with this, but it's pretty much whenever your employer or the patient takes the responsibility of paying out of pocket for any type of, just basic wellness, preventative type of care. And this is obviously where the whole market is trying to force us. Like, I feel like with all these high deductibles, they're pretty much training us to go about, paying out of pocket, right? A lot of people have super high, premiums that they're paying, as well as it's also a setup where, like, they're encouraging everybody to use this health savings account, so you could pretty much make it back on the patients, or back on the employers, to say, okay, we're going to take it over from here, and we'll cover any type of basic needs, and let the insurance operate like automobile insurance, which is an interesting concept, where you only need it if there's something major that happens. Like, if you think about it, like if your car needs maintenance, oil change, you're out of pocket. If your car blows out a tire, you buy the tire. Your insurance doesn't cover that. But if if your car gets into a major accident, then insurance steps in and saves you from going bankrupt or having to pay for all these damages out. And so, that's what the health insurance doesn't currently do. So it'd be great if there was a model, and I think this has a piece of it that will help us get there. So now, again, we got to think about this. This is a big issue. It's a big system. It's difficult to just wipe the slate clean and say, let's move forward with this. It sounds great, but much easier said than done, right? And so we got to think about, how can we evolve this actual healthcare system? And I think this direct primary care process is a step, not the total solution, but a step. So, let's talk about what it's not. Primary care is not that concierge or boutique type of practice. I'm not talking about whenever you have a doctor on call. A lot of people these days are paying a couple grand, $5,000, even $10,000 to have a doctor on call for their family. He'll come out to the house. He'll do all, everything that they need. Blood work. He handles it. He's their point of contact for everything, right? I'm not talking about that. And I'm also not saying that direct primary care means that you don't need insurance. Again, this is supposed to operate like the automobile insurance, where it's just enough to kind of cover you for major incidents. So it doesn't replace your insurance. And, and the whole goal of this is to think about how they can really go about keeping the patients healthier and trying to reduce that catastrophic cases and care that really wipes people out. So that's why I kind of like it. This is going to avoid people paying those super high deductibles for one. That's a plus, as well as it's going to put some more of that responsibility back on the doctors to say, okay, I want to give the best care, because now they have to operate like a regular business. And this, to me, lies the fundamental issues with what goes on with healthcare right now. And I think this is a unique opportunity for guys like myself. I'm a marketing guy. I'm a sales guy at heart. I work in healthcare. I sell to a lot of people, lots of these doctors, and, I got some really interesting clients. However, I'll be quite honest with you, they've been spoiled. They've been spoiled by the fact that they can rely on codes, and that time is fading, and now they're forced to operate. Now, what's great about it is that I believe a lot of my clients are, looking for that cutting edge tech, and they're doing things that's going to be best suited for the actual patient. So with that, now you got to bake in the good business practices, right? So you have the right heart, you have the right intentions, you're doing the best that you can to take care of your patients. But like in business, you got to have the sound activities and the sound business principles behind what you're doing, and back to basics, back to basic branding, back to getting the word out. And it's just, you got to take care of people so they naturally spread what you're up to. So anyway, that's my quick rant. Denver was great. On a side note, had some cool conversations. Like, my first meeting was with Dr. Oakley out of downtown Denver. If you're looking for a good chiropractor, man, she's lights out. She really check her out, give her a shot. But one of the conversations we had was how people are, right, there's this really good research study by John Hopkins and how they're using shrooms to help take care of people these days. So that's kind of a emerging, up and coming trend that's happening, where they're mixing in more of this herbology into their care. So trying to find some natural ways instead of going directly towards the opioids. Also had a really good meeting with the medical specialist company, and we talked about how the billing is just kind of going way south and way backwards. But anyway, we had a great conversation around this whole process of this direct primary care, and how people are, pretty much jumping over the old school way of trying to find billing to kind of cover a lot of their costs, and saying, I'm going to put it on myself and provide this for people and offer this membership type service. And last but not least, had a great meeting with Dr. Grove out of Colorado Springs. He works with a lot of the Olympic athletes out of Colorado Springs down there at the main training facility. And man, he just has a lot of really interesting tools, and it's just a matter of him finding out how to get the word out about what he's up to. So anyway, quick recap of my trip. But you know what? Let's connect. I would love to get your thoughts on this direct primary care. If you're doing it, if you know people doing it, would love to hear from you. Hit me up. I'm at joealexlemon.work, WORK. That's the website. Or you can hit me up on any major platform. Twitter. I'm on Instagram every once in a while, but Twitter and LinkedIn are pretty hot for me. So that's at joealexlemon. Until next time, you guys be phenomenal.
Thank you for listening to the Real Value Exchange. If you want to continue this conversation, visit joealexlemon.work. Don't forget to subscribe for more episodes.